Welcome back. By now, we've all heard about the Zika virus and the danger that it presents to pregnant women and even those considering having a baby. But most of the coverage of the virus has been how it affects women in places like Brazil or other tropical places. Well, Kelly Wilhite, Assistant Professor at Frontier Nursing University, here to tell us some preventative measures to avoid contracting the virus and to kind of lay to rest some of the fears, because we're still fairly safe here in Kentucky, right, Kelly?
Yes, that's right.
Okay.
So everyone is worried about the Zika virus. For the average person, it only causes a mild virus, but pregnant women, for them, for some reason, this virus can lead to a toxic reaction that could lead to birth defects. So
Sure.
For good reason, pregnant women are very concerned, but we try to reassure them that right now in Kentucky and as far as the continental United States, there are no mosquitoes that are carrying the Zika virus.
Sure.
And that's one mode of transmission, is by mosquito. The other method of transmission is by intimate partner contact.
Sure.
So one thing we're telling pregnant women is beware of where you are traveling outside of the United States. They can check the Center for Disease Control website to see what countries are affected right now.
Okay.
And then avoiding intimate contact with partners who may have lived recently or traveled to foreign countries that are affected as well.
So those are the best way to protect themselves.
Well, for right now, we don't have a vaccine, which
right.
is unfortunate.
Right.
But mosquitoes have never been our friends.
Right.
So we just need to avoid contact with mosquitoes and try to prevent areas where mosquitoes can breed. So if women wear long sleeves and use insect repellent, just basic strategies to prevent mosquito bites. Around where you live, look around and see if there's any areas of standing water where mosquitoes could breed, and get rid of those. And just be cautious around the time of day when mosquitoes might be around.
Okay, and yeah, that bug spray, if you can find one. I know some people are sensitive to what's in it, but find there's ones for sensitive skin or that don't contain certain chemicals, or even citronella.
Absolutely.
Can help keep those at bay.
Actually, yes.
So what should a woman do if she thinks she may have been exposed to Zika and she's pregnant?
So if she's concerned that she might be exposed, the first thing to do is talk to her midwife or OB provider about that, to see if the exposure might have been something to consider at risk.
Okay.
The other thing she can do is check on the Center for Disease Control website to see what updates are there, to see if there's any new information to consider. Most likely, the transmission here, especially in Kentucky, would be very rare, so most likely she will not have been exposed.
And most women, if they're pregnant, seeing their doctors pretty frequently, so it's something that they can bring up at their next appointment.
Yes.
Okay, very good. Well, Kelly, thank you so much for coming in and
Thank
laying
you.
to rest some of those stresses and kind of chaos surrounding the Zika virus. It is not a huge problem here in Kentucky. Just be vigilant if you're pregnant, right?
Absolutely. Thank you so much, Lauren.
Of course, thank you. And we are back with more for you coming up right after this.